Pay no heed to public's health, Boris gives alibi for Plan B stumbling block, Profs give thumbs down. England is currently under Plan A, which puts almost the entire weight of the COVID recovery on the vaccine. Under current rules there are no requirements to social distance or wear masks. However, under the government's Plan B for winter, which was first revealed by the Prime Minister back in September, masks would once again become compulsory in indoor public spaces in England. Mandatory vaccine passports for large venues such as nightclubs would also be introduced, as they have been in Wales and Scotland. The government website states that people would be required to show their NHS COVID status certificate in all nightclubs, indoor settings with 500 or more people, outdoor, crowded settings with 4,000 or more attendees, and any settings with 10,000 or more attendees, such as large sports and music stadia. The recent surge in COVID cases across Europe has largely been sparked by vaccine hesitancy, slowing vaccination rates and the rollback of infection control measures such as face mask mandates. More than 2/3 of people across the UK are fully vaccinated, including almost 69% of people in England, according to Our World in Data. The figures are roughly the same as Austria and Germany, and lower than the Netherlands' vaccination rate of 72%, where fresh lockdown measures have been introduced. Mr. Johnson has insisted that improving overall vaccination rates across the country and encouraging uptake of the booster jab is the best line of defense against a surge in infections this winter. Unfortunately, what you've got at the moment is a situation in which the waning of the original 2 jabs is starting to see too many elderly people getting into hospital, he said during a hospital visit in Hexham earlier this month. The key thing you want to do is to reduce those pressures, which are building on the A&S, on beds, by encouraging people, particularly the over 50s, to come forward and get your booster jab. Professor Whitty warned that we're beginning to see a winter respiratory effect of other viruses impacting on the coronavirus pandemic and putting substantial pressure on the NHS. He said, there has already been a very significant increase in Eastern Europe which is still ongoing, with significant numbers of people dying, in particular among the unvaccinated. That has now moved westward and, as you can see, is now increasing significantly, also in many Western European countries. The PM added, we don't yet know the extent to which this new wave will sweep up on our shores, but history shows that we cannot afford to be complacent. He said, those countries with lower vaccination rates have tended to see bigger surges in infection and in turn been forced to respond with harsher measures, while those countries with higher vaccination rates have so far fared better. It shows us that if we want to control the epidemic here in the UK and if we want to avoid restrictions on our daily lives, we must all get vaccinated as soon as we are eligible. Despite the concern over the winter months, Mr. Johnson said there was nothing currently in the data to suggest the country needed to move to Plan B, which would include mandatory face masks, COVID passports and a directive to work from home. But Professor Whitty said a rethink on whether restrictions should be introduced would be needed if case numbers increased on the scale seen in Europe. He added, I think we have got a difficult winter ahead of us. I think that is a widely accepted situation. The NHS is a remarkably resilient organisation. But nevertheless everybody would accept that large parts of it, particularly the ambulance system, but there are others, A&E and others, are under significant pressure, and I'm afraid are likely to remain so over the winter period, which is why all health staff would reiterate the point the PM has made about encouraging people to get vaccinated.